रहा है सर।
लिखे अपन को तो मालूम चलेगा।
एक मिनट, ये लाइव होने जा रहा है यूट्यूब पे, तो आधी मिनट लगती है। Okay, Sanjay, we can start.
Good evening, everyone. I am Pranjal Wankede from Remedies Private Limited. As you know, Corona is among the top 5 gynecologist company in India. And being a responsible organization, we at Corona always support and participate in different scientific programs, such as the CME and webinars. Corona Pharmaceutical is serving in gyne fraternity as a dedicated academic partners. And every time we bring a new topics with the latest updates and expert opinion. This time we are initiating a new series of webinars on a different medico-legal aspects. We are here with the first program of the series on a documentation, a legal shield against medico-legal problems. You all know in India, we start our each program with auspicious things. So we'll start today's program with Ganesh Vandana, then I'll introduce our respected speaker.
वक्रतुण्ड महाकाय सूर्यकोटि समप्रभ निर्विघ्नं कुरु मे देव सर्वकार्येषु सर्वदा.
I welcome our respected speaker, Dr. Gitendra Sharma. Doctor is practicing gynecologist and obstetrician in Ahmedabad for 30 years. He is a MD in Obs and Gynae. Dr. Gitendra Sharma is a medico-legal counselor, done his LLB with the 15 gold medals, topped in Gujarat University in law. Doctor also authors the books like Law in Obs and Gynae Practice, second book Consent in Obs and Gynae, and Law as a Doctor Must Know. Doctor has given more than 1,600 lectures and 10 oration all over India. Doctor was a vice president of FOXI in 2022 and 23. He also was a chairman in Ethics and Medico-Legal Committee FOXI in 2017 to 2019. Doctor was a president of AOGS in 2016-17 and hosted a AICOG in 2017 January. Dr. Honorable Joint Secretary of SOGOG in 2017 and 19. So I welcome Dr. Gitendra Sharma and I hand over the session to you. Thank you, sir.
Good evening, dear friends. At the outset, I would like to thank Pranjal for giving my kind introduction. At the outset, I would like to thank Corona Remedies for arranging this lecture, which is very important on medico-legal aspects. We all know that ignorance of law is no excuse, and prevention is always better than cure. You can prevent the litigation only by getting knowledge. So only a way to prevent the litigation is that you should know what law says and how to protect ourselves. It is said by one of the senior most judges in court that courts are not the court of justice, but they are court of evidences. So court sees only things which are shown to them and nothing else. So dear friends, court in Hindi, it is known as Nyayalaya. Nyayalaya is a misnomer. You are not getting justice or Nyay in court, but actually they go and they give the judgment which may be justice or which may not be justice. In medical field, documents are the only evidence with a doctor in his defense, and only document speaks in the court and nothing else. In many cases which we come across, whenever a doctor comes to us, he usually tells us सर मैंने तो पेशेंट के लिए अच्छा किया था, whatever is the best to the patient I have done, but still I lost the case in the court. So when we see their document, they might have done everything in the best interest of the patient, but they have nothing, not documented it properly. So if you document it properly, only then it will be considered in the court of law. So it is said that good documentation is good defense, poor documentation is poor defense, and no documentation is no defense. In my lecture today, whatever you will see in inverted comma, all the things are being either said by National Commission or by Supreme Court. So I have quoted everything because whenever we speak medico-legally, we speak evidence-based things. So everything what I speak will be evidence-based. So I have said that poor record means poor defense and no record means no defense. So these were the wordings of National Consumer Dispute Redressal Commission in the case of Dr. Rajni Kumari versus Amarkant Sharan, and also in the case of Nazarat Hospital versus Sona Singh. So whatever I want to say, that I am not going to speak a single word from my side in this lecture, but all the things which I will quote today will be evidence-based through some case record. To understand what is documentation, we must discuss documentation in different way. One, we should know that what is the meaning of document. Then why to document, we should know. What to document, when to document, how to document, where to keep document, how long to keep document, how to destroy the documents, whose responsibility is to keep document, what is the characteristics of good document, what is to be given to the patient when they demand for the case paper, and what is not to be handed over, what is the confidentiality of document, how should you keep the confidentiality. And new things are coming out day by day, that what is medical audit and what pitfalls during medical audit we find in case paper or in document. And last but not least, we will look into a few decided cases by different courts, which are very much important to know how court interprets that, how the documents should be. To understand what is document, see section 29 of Indian Penal Code and section 32E of Indian Evidence Act, they define the word document. Document denotes any matter expressed or described upon any substance by means of either letters, figures, or marks, or by more than one of these means, intended to be used or which may be used as an evidence in that matter. So for example, anything which is written in case paper, anything which is printed or photographed or audio video tape, etc., can be used to furnish evidence or information while treating the, and that's why it is document. So in short, something by which the message can be conveyed to others even in your absence, that all things are considered as document. Whether it should be a paper, whether it should be audio cassette, it may be video cassette, it may be anything. We all know that documentation is the most tedious job for a medical practitioner. Still, there cannot be any excuse under law for not keeping records. Why to keep record? This question comes into our mind. So we must understand that a doctor is bound to produce record when asked by the court, and if he does not, adverse inference might be drawn. Again, this was reiterated by National Consumer Dispute Redressal Commission in the case of Srimati Darshini Devi versus Dr. Kamal Bhushan Jain. So whenever court demands, it is a duty of doctor to produce the case paper, not of the patient. And that's why we should keep document. Under some act, if you don't keep record, it is punishable too. Like in MTP Act, you have to secure Form C, that is consent form and opinion form. in a sealed envelope for 5 years. Under PCPNDT Act, you have to have records of filling different forms and other things for 2 years. So in Indian Medical Council Code of Conduct, Etiquette and Ethics Regulation 2002, section 1.3.2 says that if any request is made by the patient or by any authorized attendant of the patient or by any legal authorities, then the same may be acknowledged and documents shall be issued within the 72 hours. So if some patient demands case paper of her own treatment, then it is your duty to provide within 72 hours. If you don't provide, then there is a provision of punishment under section 7.2. Doctor is liable of disciplinary action if she does not maintain record of his patients for a period of 3 years. And if he refuses to provide the documents within 72 hours when request is made. So, dear friends, there are many reasons why documents are to be kept. In the case of Medical Superintendent Lok Nayak Jayaprakash Narayan Hospital and other versus Santosh, who was minor, here the documents not to provide, it is said by the court, National Consumer Dispute Redressal Commission, that not to provide record on written demand by authorized person within 72 hours amounts to deficiency in service and negligence. So, dear friends, it is compulsory to provide on demand within 72 hours all the case paper. We all know that certain documents are required by law. Certain documents are required to be maintained as a part of guideline given by authentic bodies. And most are the part of standard practice accepted by all professionals. We know nowadays there are so many accreditation systems like NABH, JCI, FEQ, and many more. So if you want to qualify for this accreditation, again, you have to keep your documentation. The purpose of documentation: for communication purpose, your document can be used to communicate to some other doctor that what treatment you have done. If you want to plan your care, then again document will be needed. For continuation of treatment, you have to go through the record that what treatment is done previously. If you want to change any treatment, again documentation is necessary. If you want to analyze your decision, if you want to educate the people for academic purpose, for legal purpose, for reimbursement purpose, and for documentation or historical documentation purpose, for every purpose, documentation is must. Documentation always gives you the quality of care. So if your documentation is good, that is a reflection that your quality of care is good. And if your documentation is poor, even if you have given the good quality treatment to the patient, but it will be considered that you have not treated the multiple reasons why these documents are required. Requirement for reimbursement, for legal protection, for research, and it is a reflection of good patient care. Now, what is document? In the case of Nazrat Hospital and others versus Sona Singh, in this case, the National Consumer Dispute Redressal Commission has defined that what are different kinds of documents which we should keep. So records can be divided basically into two parts. One is patient-related record and second is hospital-related record. Now, patient-related record may be the OPD record of the patient or indoor patient file or indoor patient record of the patient. And hospital-related record can also be divided into two parts. First, that patient-related means medical-related records and other than medical-related records. So let us see what all these records are. Again, whatever I mentioned in inverted comma, they are the reutterance of different courts. I have said either National Consumer or by the Supreme Court. So in the case of Indu Sharma versus Indraprasth Apollo Hospital, National Consumer Dispute Redressal Commission has quoted that the thing which is not documented has never happened. So if you have not documented something, it will be considered by court that you have not done it. So case record. In OPD, you have to have registration form, OPD consent, chief complaint, history taking, examination, provisional diagnosis, then investigation, request slips and reports. You have to reach final diagnosis, and after final diagnosis, you have to plan the treatment. Then after plan of treatment, you have to counsel the patient, medical counseling, financial counseling, and if psychological counseling is required. And then after taking proper consent, give proper prescription or start the treatment if you want to do any kind of operation. So these are the OPD case papers we are supposed to put in our file. In indoor case file, again, it starts with registration form, admission consent, and then chief complaint, history and examination. Then we are supposed to put provisional diagnosis. We have to confirm our provisional diagnosis by investigation. Then we are supposed to put final diagnosis and plan of treatment, which should be counsel, proper consent should be taken, and then pre-op, per-op and post-op things starts. And all reports are to be annexed. And at last, checklist should be put, discharge card should be issued, and every page should be numbered. So pagination should be done. So this is the way of keeping indoor case paper. Now, what are the things we are supposed to keep as a document in the court, in our hospital? All OPD case paper, indoor case paper, all consents, prescriptions given to the patient, discharge card, investigations, report, reference note, refer notes, request of investigation, photographs if you have taken, CDs or DVDs, medical certificates if you have issued, if some forms are filled, or if you have made some entries in some register, everything you are supposed to keep in your custody. Regarding hospital records which are related to medical things. So in hospital, know that we should keep certain registers for our purpose, for proving ourselves whenever it is required. So the most important registers are OPD case registers. There may be 3C register, that means daily income register, indoor case register, operation theater register, autoclave register, fumigation register, biomedical waste register. If you are doing MTP, then MTP register, PCPNET register, birth register, if you are dealing with the obstetric patients, IUCD register, sterilization register, drug register, MLC case register, and police information register. So these are common registers which we are supposed to keep in the hospital. Hospital records, other than medical records, we all know that on a single hospital, there are more than 150 acts which are applicable. And under different acts, we are supposed to comply them. So all licenses which we have, all insurances which we have, they are also called documents, and we should keep it with us. Now the next question comes in our mind, that suppose patient is serious. So whether we should treat the patient or whether we should immediately first document and then treat the patient. So when to document is a question. One can document within reasonable time. One can document later, but the time of finding should be written as actual. So these two things which we should keep in our mind. Again, the judgments codes, National Commission says that record should be maintained on minute. Friends, many of our friends who are giving medical legal lectures on document, they used to interpret minute to minute basis means that when you are treating the patient, one team should treat the patient and one team should write the document. Dear friends, it is not so. In this judgment of D. Uma Devi and other versus Yashoda Hospital, it is mentioned that whenever patient is serious, or in the case of cardiac arrest, whatever you document, it is not that you should document immediately while treating the patient, but you have to treat patient first and then you can document it later on. But whenever you will document, you should document it on minute to minute basis, that at what time you diagnosed cardiac arrest, at what time you started oxygen, at what time you intubated, and what times to actual treatment started. So it should be time wise. That is the purpose of this judgment. Document should not be prepared very late without reasonable excuse. So medical records that are written after the discharge or hours after death do not have any legal value. That is the judgment in Dr. Rajni Kumari versus Amarkant case. Record should be completed and deposited in MRD within 72 hours of discharge or death. This is the judgment of VP Neelkantan. In this judgment, Kerala State Consumer Forum has given this judgment that you should complete your document within 72 hours. Ensure that the records are complete once emergency is over. So if you are dealing with some emergency, then as soon as emergency is over, you should document it as early as possible. How to document? Document is an art which everybody should learn. We know that during our curriculum of post-graduation or graduation, nobody teaches us how to document. We can improve ourselves in documentation by doing internal and external medico-legal audit regularly. How to keep document? See, we all know that in many judgments, the court has uttered that efforts should be made to computerize medical record for quick retrieval. The same is mentioned in Indian Medical Council Code of Conduct, Etiquette and Ethics Regulation 2002 in section 1.3.4. So digitalization of patient record is to be done. Now you can write your document, you can type it, you can computerize it. So in whatever format you want to keep your document, you can keep your document. Now everybody says that what is the fear in our mind that somebody who is practicing for last 25 years, now aged person, he says that computers are difficult to learn. How can I learn computer? We don't know typing. We have never used computers. This is not the age to learn. We all know, dear friends, that mobiles were not there. And now everybody is dealing with the mobile. Even if somebody is 80 years or 70 years. So we do use emails. We deal with the computers. So it will come naturally in our practice. We were not doing laparoscopy before 1975. But as soon as laparoscopy started, everybody learned laparoscopy. Sonography came in 80s. So we started doing sonography after 80s. So dear friends, these excuses will not remain. We all know that there are many programs, desk-based or web-based program. So whatever you are acquainted with, you can use. Always web-based program are more easy to handle and it is more accessible and easy. We all know, dear friends, that after 50 years, a person who shall be knowing how to write with pen or paper, he will be considered as the one possessing some great old ancient art. So that means now everything should be online day by day. There are so many excuses with our friends that we have limited time, limited staff and everything. But these excuses are not going to help them anymore. Again, one of the court judgments says that an unsigned medical record has no validity. So every finding should be properly dated and time and to be signed. And not only signed with name, because short signature without name are not valid. Anybody can write the notes, but it should be signed by the responsible person. So your assistant may write the operation note, but ultimately it should be signed by the surgeon. Case should be maintained and written in chronology of event. Not putting case in proper chronology amounts to deficiency in service. There is a recent judgment of by Chandigarh State Commission, Punjab State Commission. In that decision, the court has said that although doctor is not negligent, but his case paper, doctor's case paper are not put in proper chronology, and not putting proper case in proper chronology amounts to deficiency in service, and 35 lakhs rupees compensation is granted against the doctor of Ludhiana. Every doctor has attended patient should put his initial with date and time. So we see sometimes one patient is treated by multiple doctors, referred to multiple doctors. So every doctor who see the patient should put his finding and put his initial with date and time in the case paper. Ensure that all doctors involved in the management mark their presence in medical record, because it helps in the court of law later on. Patient, so everything, whatever I am quoting, all are the wordings in different case. I am not quoting specifically the case citations everywhere, but whatever I have written in my slides in inverted comma are the decisions of different courts. Another thing is, patient if refusing for treatment, non-cooperation from patient and relatives, mistakes and neglect done by patient in following instructions should be specifically noted down in record. So if you will note down that a patient is not following your advice, then patient will be responsible for contributory negligence, and you will be saved. Patient not following advice should be documented positively. See, documentation is an art. One must document in detail the misbehaviors and obstruction done in treatment by the relatives. These were the words in the judgment of Malay Ganguly. We all know the case in which 11.5 crore with interest compensation was granted against Amri Hospital, Calcutta. And in this hospital, Bridge Candy Hospital was also the party. But the documents of Bridge Candy Hospital saved them from the compensation. Manipulating, altering, correcting medical record amounts to negligence. So we should never try to alter the record. Tempered medical record is a criminal act. As soon as you will try to temper the record, it attracts forgery. Indian Penal Code 468 will be applicable, that you have tried to forge the documents, and that is not allowed. So never try to alter the document, because for saving yourself, if you do something, you will be in more trouble, because forgery is non-bailable offense under IPC, under section 468. Many times we see that people try to erase something which is written, or they put white ink, or they try to put a chip on something written. Don't do this, because it amounts that court will presume that you are trying to hide something. So erasing and putting white ink to be avoided. Rather than that, only you should cut a wrong entry with simple line so that it should be visible that what was written previously, and put right entry nearby with your signature and date and time, and that will be considered by court. Manipulating and fabricating medical record is not only illegal but also unethical. If found by court, party loses sympathy of court, and that's why we should never try to alter our records. See, we always say that whatever amount of alteration you will try to do, but you will never be it will never be possible to make an elephant a tiger out of an elephant. You can never make a tiger out of an elephant. So never try to alter the record. All entries to be done at designated places, otherwise they will be construed as added later on. We have come across during edit that many of the doctors are writing in oblique fashion. So something is written in some corner, some other things are written in some other corner. So they are not writing it in a proper designated places. So the entries which are not done in a proper designated places may not be regarded by court, and it will be presumed by court that these are added later on. Discrepancies or inconsistency in medical record leads to problems. Suppose some doctor is examining the patient at 5 p.m. and write 2080. Other doctor at similar time writing that BP was 150/100. So if there is any discrepancy in your case paper, if doctor's note and nursing notes are discrepancies there, if two doctors look into the patient, treating the patient, if there are any discrepancies in their finding, then it creates problem for you. Use of confusing abbreviation in medical record amounts to deficiency in service. In one of the case, doctor used ES for emergency surgery. The court said that ES can be elective surgery. There is no such abbreviation which is uniformly acceptable all over the world. So only abbreviations which are universally acceptable all over the world, only those abbreviations can be used in document. Others should be avoided. One doctor used DIL for dangerously ill patient, the court remarked that we use DIL for daughter-in-law. So these kind of abbreviations are to be avoided. In one of the case, it is said that never use abbreviation in the name of medicine, and it also amount to deficiency in services. In most of the anesthetic note, when we go through the notes, they write injection glyco for glycopyrrolate. One anesthetist wrote glyco for glycopyrrolate, and he was punished with 20 lakhs rupees compensation. So never use, because with the name which starts with glyco, there are many injections available. Same in infertility practice. People give decapeptyl as an injection as a trigger, but they used to write injection deca only. Deca can be deca durabolin, it can be decadron. So court said that you cannot use misleading abbreviation, otherwise it will amount to deficiency of services. If we start from the beginning, from the case paper, we see the form, people do many mistakes. They write short names. In one of the case of Suman versus multi-speciality hospital, in that case it was said that name should be written complete with name, spouse name and surname, because on the same day 3 Sumans were admitted in that hospital and their blood interchanged, and one of the Suman died due to blood transfusion reactions. ID mark is compulsory in case paper, which almost nobody put. Chief complaint should be in the language of patient. See, whenever we write in our case paper, particularly in infertility, we write primary infertility as a complaint or secondary infertility is a, see, these are diagnoses. We should write chief complaint in the language of patient, not the diagnosis. When we take history, it is mentioned in one of the case that history should be noted in details and negative history should also be noted. So negative history should also be positively noted. So we should write that there is no history of diabetes mellitus, hypertension, heart disease, allergy, or thyroid disorder, or COX. So negative histories are also we are supposed to document, because if we write put dash only against all these columns, it will be presumed that you have not asked the patient. But once you write no such history, that means you have asked and patient has told you that there is no such history. History, if incomplete, can be construed as deficiency in service. If you are not able to elicit history from the patient, it is your negligence. If patient hide history, even on asking, it will be a case of material suppression on the part of patient. And it will be, that patient will be held responsible for the contributory negligence. And that's why we should note negative histories. Record specifically gestational age and expected due date of delivery in obstetric patients. So we have tendency that we write only LMP. Sometimes we don't write EDD. So we should write positively the EDD. In one of the judgment, it is said that obstetric history should be taken in details. So we have to, details means any happening in previous delivery, whether it was a normal delivery, whether there was an episode of PPH in that delivery. So everything should be asked in detail to from the patient. In examination part, examination done should be reported in details. NAD is not acceptable. Many of the gynecologists have tendency to write PS NAD, PV NAD. That is not acceptable. You have to write PS, cervix norm healthy, vagina healthy, no discharge per vaginum. Or in PV, you should write uterus antiverted, normal size, firm, mobile for nice here. So everything should be mentioned. And if patient is non-cooperative in examination or refuse for examination, document it. It will save you in the court of law. Whenever you do investigation, it is said that over investigation and under investigation, both are considered as deficiency of services. Not prescribing mandatory investigation as per guideline is considered negligence. So whenever some investigation is necessary, you have to ask for. If doctor has prescribed investigation and not done by patient, then patient will be responsible for the same. Investigation should be done timely. In case of doubt, if confirmation is done from any other laboratory, it proves your diligence So it is always advisable that if your report is doubtful, you can confirm it with other lab. And if you do that, that means it will be proved that you are diligent enough, you are not negligent. And reports must have been signed. Unsigned reports have no validity. Many a times pathological reports bear no signature. So these reports are not valid. Investigation done must be annexer. So all the reports must be annexer in your case paper. And about that, result of all reports should be noted down in the case paper, that is bad head ticket. So even if you have annexed the report, but the report should also be noted down in the bad head ticket, so that it will be presumed that you have taken into consideration all the reports which are annexed. Pre-hospitalization record of investigation and treatment. Suppose somebody brings some report from outside. So if you consider those reports in your treatment, then you should preserve the report as an annexer in medical record. Date of investigation is very important. You have to write with every report that on which date these reports were done. In regard to diagnosis, after investigation, we should reach to the final diagnosis. Means diagnosis after investigation. So it should be justified. So whenever you put final diagnosis, it should be justified through your history, through your examination finding, through your investigations done. You cannot write anything without any proof as a final diagnosis, because according to final diagnosis, we have to plan our treatment. So diagnosis should be complete. See, these all inverted comma things are the wordings of courts. I have said National Commission or Supreme Court. Diagnosis should be complete. Proceeding with treatment without confirming provisional diagnosis by confirmatory test is construed as negligence. So first you have to confirm your diagnosis, only then you should plan the treatment. Proceeding with treatment after confirming by history, examination and investigation cannot be construed as negligence. So your diagnosis should be justified through history, examination and investigation finding. After final diagnosis, you have to plan the treatment. So whatever you plan the treatment, you have to record the reason of treatment in medical record. Plan of treatment should be justified to case history, symptoms, investigation, and final diagnosis. Suppose some infertility specialist write in diagnosis that patient is primary ovarian failure and azoospermia. And now in treatment is writing, I am going for self-ICSI. So it is not justified. So whatever plan of treatment you decide, it should be justified. You have to do, once you decide the plan of treatment, you have to do counseling, medical counseling, financial counseling, and if required, psychological counseling. In medical counseling, procedure which we are going to do should be explained beforehand. So it should be a detailed medical counseling. You have to explain to the patient the purpose of treatment, the success rate, the alternatives available, the risk of treatment, and every details should be mentioned in detail. Inform the attendant, say whenever the patient is serious or patient is in operation theater or in ICCU where the relatives have no access. So patient is in four wall. So it is your duty that inform the attendants at regular interval about the patient's condition, especially when the patient is critically ill. So whenever the circumstances changes, a fresh medical counseling should be arranged. We all know nowadays financial counseling is also important. In one of the decisions, it is said previously that probable estimate of treatment shall be given to the patient, because as government or MCI has not fixed any charges, so one can decide his own charge. But according to new CPA and Clinical Establishment Act, now it is compulsory to do financial counseling. And if you charge even a single paisa more, whatever is explained to the patient in writing, it amounts to unfair trade practice. And for doing unfair trade practice, you can be punished for 10 to 20 lakhs rupees fine directly by Central Consumer Protection Authorities. So, dear friends, Financial counseling you must do with full precautions. We all know that counseling is very much important, and whatever you counsel, whatever you communicate to the patient, when you put it on paper, so documentation of counseling and communication is defined as consent. We all know the judgments of Samira Kohli versus Dr. Prabha Manchanda, Jaipal Reddy versus Padmini Velluri, Vinod Khanna versus RG Stotal. It says that uniform pre-printed consents are not legal and it amounts to unfair trade practice. So all consent should be procedure specific. And answer to this, to all kind of fraternities is there in one website that is known as www.consent4.doctor.com. So on this website, you will get all procedural specific consent. So we have to take procedure specific consent. In different judgments, the different verdicts are given, the different quotations are there, that consent should be properly filled before taking signature of the patient and witness. So this is mentioned in Jaipal Reddy's case, that you have to fill all the columns of consent. Only then you should take a signature. Unfilled consent, you cannot take signature because it amounts to blanket consent, and blanket consent is invalid. Have a habit to take negative consent. So if patient says that I do not want to undergo this treatment, you should have an habit to take negative consent. You should take separate consent for anesthesia, for blood transfusion or blood product transfusions, for subsequent surgeries. So you have to take fresh consent for these all things. Blanket consents are not valid consent, and consent should be signed by patient and doctor, both with two witnesses. So if patient is below 18 years, in Dharmadas versus Mori Bibi case, it is clearly mentioned that any contract with minor is void ab initio. So whenever patient is below 18 years or patient is insane or mentally retarded, then you have to take consent from the guardian. Consent obtained during the course of surgery is not acceptable. So somebody is lying on table, you cannot ask that patient that, do you want to undergo ladka hua hai and now do you want to undergo sterilization operation? So patient says, okay, do it. That consent is not valid. So when patient is on OT table, any consent given by the patient cannot be considered as free consent and it is not valid. Something which is not indicated should not be done even with consent. So nowadays people are doing cesarean on demand or some operation cosmetic surgeries on demand. Okay, so if it is not indicated, then no surgery should be done even with consent, because that consent will not be a valid consent. In pre-operative thing, once you have taken consent, you should start pre-operative. So pre-operative orders must be recorded in medical record. Not recording pre-operative orders amount to negligence. So you have to document in your case paper that you should come kneel by mouth for 8 hours or whatever orders you are supposed to give to the patient. Pre-operative investigations are must. So if you are doing minor operation, minor profile. If you are doing major operation, major profile should be done. In pre-operative anesthetic checkup, anesthetist must ask history. He must document investigations and he should ask for the past medical and surgical history and take necessary precautions. Anesthetic note must be written in details by the anesthetist. It should include graphical record. Details of name and quantity of the anesthetic agent should be mentioned, and it must be initialed by the anesthetist himself. So whatever injections are given in operation theater, it should be mentioned by anesthetist in his operative note. And regular inspection, temperature, pulse, BP, SpO2, everything should be mentioned regularly at regular interval, and it should be put in a proper graph. Anesthesia note should be clear mention of which type of anesthesia is given. So he should clearly mention whether GA given, spinal anesthesia is given, or local, and no abbreviations or short names of medicine should be used. We have mentioned that injection glyco, injection mida, injection propo for propofol, these kind of injection cat for ketamine, these all abbreviations are not allowed. in operative note should always be in details. We always tell our friends to write operative in details, because recently in one of the cases, a doctor did hysterectomy, and after hysterectomy, patient developed complication. Now, that was the TLS, total laparoscopic hysterectomy. Now the question, it was a ureteric injury post-operation. Now, when question was raised in court that why this has happened, so doctor said that, sir, in right iliac fossa, the right side, there was very big broad ligament hematoma, and we were not able to isolate the ureter, and that's why this injury might have happened. But when his operative note was shown to the court, this broad ligament hematoma was nowhere mentioned. They were not able to isolate ureter, it was nowhere mentioned. So court said that something not mentioned in operative note will be considered as not done. So dear friends, you should write your operative note very perfectly in detail. Surgeon must sign the operative note. So whoever may write, but surgeon has to take responsibility and should sign the note. Record the correct time, that is start time and end time of the surgery, and record the details of implants if used any. So if you use any implant, you should put proof that what implants you have used and what is the expiry date of that implant. Every day, in post-operative care, every day, see, when patient is admitted for more than 2 days or 3 days, every day, the first finding should be complete, and it should be a fresh order every day. You cannot write in your first note that CT treatment. It is not advisable. So every day, the first note should be a complete note with complete treatment of that day, which is planned. Every finding to be dated and timed and with signature, and short signature are not valid, and that's why name should always be there with signature. Frequency of checkup of patient should be as per medical norms. Post-operative instruction, it is said that improper OPD prescriptions, especially if post-operative instructions are not properly written, can result in damages awarded by courts. So you should write detailed post-operative instructions. In follow-up advice, you should write many things, because if you will write and patient will not follow, you will be saved. But if you will not write, it will be considered that you have not guided the patient properly. So post-operative instruction should be clearly written in your record. In nursing chart, record whenever a nurse informs patient's condition to the doctor over phone, she should document it, that I have informed on phone these things. There should not be any discrepancy in discharge summary and in case paper. Otherwise, it will be construed against proper follow-up advice against doctor. And proper follow-up advice should be mentioned in detail in discharge summary. Discharge summary shall be issued even if you discharge against medical advice. So if you are leaving patient against medical advice, or patient is leaving your hospital under DAMA, even then you are bound to give discharge summary. Discharge card should be written by one person, and there should not be any discrepancy. It is said that in many cases, the chief complaint or diagnosis is written something else in the case paper, and it is something else in discharge card. So this should never happen. There should not be time discrepancy, time of admission, time of discharge. That should be, so discharge summary is a summary of case paper. So whatever is written in case paper should only come in discharge card. Anything new which is not in case paper cannot come in discharge card. Discharge against medical advice or on request should also be documented in your discharge summary. Record specific date or period for follow-up visit or review. What precautions are to be taken after discharge is to be mentioned, and to whom to contact in emergency should always be mentioned in discharge card. And discharge card should always be signed by patient as well as the doctor. Annexer all the report with case paper. It is mandatory. So in case paper, you make habit that whatever reports you have done, they all should be annexed. And not only annexer, reports should also be written in your bedhead tickets. Now the question comes, where to keep all these records? So according to new different acts are coming, which says that one MRD department in hospital is mandatory. So you have to have medical record department. You have to have hard copies of your case paper. There are agencies nowadays who scan the case paper on your behalf and put it in cloud. Computerized program, people are using HIS system and electronic medical record system. And our MCI also says that effort should be made to maintain electronic record system. How to keep, where to keep all these records? We all know that if you follow paper system, hard copy system, then you should have medical record room. And that record room should be regularly pest control and rodent control should be done. And you have to avoid humidity. Water and humidity control should be there. So it is a duty of hospital to preserve the document in a proper condition. If something happens, then hospital will be held responsible. If you put your record in EMR system, antivirus system and proper backup system should be available. Your EMR system should be such that it should not be possible to alter it. And if you alter it, it should be visible that what was previously written and at what date and time, who has altered the record. It should be visible in your EMR system. If you are following MRD, then you have to have security of your MRD department. You have to control the accessibility of the case paper. You have to maintain the confidentiality of all the records of all the patients. The communication should be privileged, means only a few persons should be allowed to they should be given privilege to take out the case paper from the MRD department. And you have to have one standard operating procedure. You have to have policy in regard to how to respond the request, whose request is to be responded and how it should be responded, how to hand over the records to the relatives, to whom it should be handed over. So you have to have a standard operating procedure. Everybody has question in our mind that, sir, how long records are to be preserved? Because हमारा तो पूरा कमरा भर गया, 2 कमरे भर गए, 4 कमरे भर गए. So how long the records are to be preserved? So dear friends, there is no answer to this question, because in Consumer Protection Act, it is said that consumer can file a case against doctor within 2 years from the cause of action. So cause of action starts when patient gets knowledge of any complication. So suppose somebody has done tubal ligation operation today and it fails after 8 years. So that cause of action will start after 8 years. So patient can file case against you even after 10 years. And if you don't have any case paper, you will not have any defense. For criminal litigation, there is no limit. We all know that the cases of Me Too in 1992 are being filed in 2020 against many of the celebrities. And their life is spoiled. After 28 years, somebody can file the case under criminal law. There are definite period given under certain law, and in those laws we are supposed to follow their guidelines. Under MTP Act, the provision is we should keep document for 5 years. Under PCPNDT Act, it is provision is there that we should keep record for 2 years. Under Income Tax Act, previously it was 6 years from the assessment year, was 8 years, but now it is amended to 3 years. Foxy says that we should keep document for 5 years. Our medical council says that it should be for 3 years. ART Act says you should keep document for 10 years. And after completion of 10 years, you have to submit your document to a national registry. And Surrogacy Act says that you have to keep record for 25 years. So these are all the different guidelines. I will like to say that in one of the cases of Dr. V.N. Shrikande versus Mrs. Anita Sena, even after 11 years, consumer courts had allowed to file a case. So that is not only 2 years when patient can file a case, it is 2 years from the cause of action. Now everybody has question in our mind that suppose I want to destroy my record after a certain period of time. What is the procedure to destroy? So definitely you can destroy the record after provision of certain times, but you have to give public notice in 2 daily newspaper. So you have to give, if you want your document, you can collect your document within this much period from the hospital, because after that, we won't be able to provide you the documents. So you have to give notice, one in English and one in local language, and newspaper, daily newspaper, one in English and one in local language. And you should write that we are going to destroy our records. If anybody wants any record, please collect from the hospital within this many period. And after giving 30 days notice, you can destroy your records mentioned as per the notice. Now, in one of the decision, it is said that whose responsibility is to make records. It is said that to prepare the document is the responsibility of treating doctor, but to preserve the document in a good shape, which can be easily retrieved, is the responsibility of hospital. So, haphazard storing of medical records by hospital is not doctor's liability. It is reiterated in one of the judgments by National Commission. Now, what are the characteristics of good medical record? We have already seen that if your record should be good, then it should be accurate, it should be complete, it should be legible, and it should be in proper chronology, free of extraneous informations. Accurate means you should document the facts, observations. Do not speculate about patient or incident. Double check all the entries. Check for any discrepancies. Recheck spelling mistakes. Recheck person, location, and medical terms. Avoid discrepancies. Not to use abbreviations. Somebody wrote SCOOR for something coming out of rectum. Avoid abbreviation in the name of medicines and injection. If you make a mistake, document it. It is better to record your own mistake than for someone else to uncover them. So if you make mistake, then you should confirm that you have done mistake and you should correct it yourself rather than somebody else will correct it. Complete record means we have seen that OPD record, Indo record, what should be the record. So record should be contemporaneous, means complete record should be there. The things which is not documented has never happened. These are the quotation in different judgments by National Commission. If it is not documented, it was not done. So court, something which is not mentioned in your case paper, court will never believe that you have done it. Your handwriting should be proper. Your record should be, document should be legible. So if you cannot read the report, you may be unable to determine what happened. Document presented in court must speak for themselves. So if document cannot be deciphered, the jury has the right to ignore it altogether. So, dear friends, these kind of things should be avoided. Here, what is written? It is lift, but it is not easily legible. So if the report is sloppy, others will assume that the care is also sloppy. And see, these are the evolution of handwritings of a doctor. When somebody is studying in class 12, what was the handwriting? And when somebody becomes postgraduate in medicine and in practice, how it turns out. So if the record is sloppy, it will not be believed. So something which is not legible will not be considered as an evidence in the court of law. I said in one of the case, it is mentioned that chronology should be maintained. And there should not be any extraneous or unwanted information in your case paper. Now, the question comes that when patient demands the document, what should be handed over? Because some of the doctors used to ask us, sir, DVD banaya de ke nahi de? So these are the questions which come in our mind. So anything which you want to produce as an evidence in your defense in the court of law should be handed over to the patient. So when patient demands, you should hand it over to the patient the complete document and the documents which you want to produce it in the court of law. So something you do not want to produce it in the court of law, you may not give it to the patient. A few precautions should be taken while handing over the documents to the patient. How to hand over? So you have to take a request letter from the patient, or authority letter of patient should be with the person who is coming to take the record. Or if record is demanded by the authority of law, by some court or by some agency which have authority of law, you have to take a request letter. After taking that request letter, you ask them to deposit money for xeroxing your document. And after xeroxing the document, you should put page number on each page. Every page is to be stamped and to be signed by a person authorized by your hospital. And it should be, that is a certified copy. And you should take an acknowledgement from the recipient that I have received these many number of pages, the record of so and so person, 1 number to 50 number pages. So that acknowledgement of receipt should be taken and it should be preserved. We have to maintain confidentiality of the record. To whom to hand over, we should know. We can only hand over the document to the patient only, not even husband of the patient. One case was filed in Hyderabad for divulging the record of a newly married lady to her husband. A case was filed against a gynecologist, and Telangana Medical Council decided against the doctor. So with the permission of patient, you can hand over the document to the others. But if the patient's condition, this authority is not there, then you cannot hand over the document to any other person other than patient. If somebody has authorized letter from the patient, you can definitely hand over, or you can hand over to the authority of law. Even if you hand over the document to the insurance people, you have to take request letter from the patient, or it should be mentioned in your admission consent that I allow that my record should be sent to my insurance agent for reimbursement purpose. So consent of patient is must to hand over the document. There are many pitfalls in medical audits. We are consultant to more than 185 corporate hospitals all over India, and we do regular medical audit in all the hospitals. And this is a new thing which has come out: medical audit, medical legal audit, clinical audit, and case audits. So these are the new things to prevent the litigation and to make us ourselves strong for defending our own cases. During our medical audit, we find many pitfalls in the case paper. I have already discussed, say from registration form to discharge card, what different pitfalls are there in the case paper. But over and above that, sometimes when a case is filed or a doctor receives notice, doctor makes try to make too much perfect record. So these are a few things which catches the eyes of judge. So if your record is too much perfect, then judge will definitely presume that these all records are made afterwards. Then monotonous evident writing. We see that on one sitting with the same pen, we write from the first thing to write up to last of the case. So that monotonous writing also catches the eyes of judges. Sometimes we have one case paper, and after receiving notice from the court, we try to make another bunch of case paper, and duplication of case paper becomes there. Sometimes one of the case paper is put in different bunch, and it creates problem. If we try to alter the records, it is always going to create problem. We all know that Apollo Institute's case, Soni Verma, in Indu Sharma's case. In that case, 1 crore rupees compensation was granted against hospital. And it is mentioned in that judgment that I am giving 10 lakhs more because doctor has tried to alter the record. Addition in consent paper should never be done. Once you have taken the signature, after that you cannot delete, you cannot edit, you cannot add anything in the consent paper, because consent is a contract, and you cannot delete or edit anything in the contract after taking signature of the person. So you should never, first you fill all the columns which are left blank in case consent, and then take consent. After taking consent, you cannot alter it. Discrepancies in time at different places should be avoided. So if there is any discrepancy, it is going to cause problem. In one of the case paper, one doctor prescribed an injection at 1 p.m. to the patient. And in nursing note, it was mentioned that that injection was given to the patient at 11 a.m. Now patient bought that from the market at 2 p.m. How can a nurse give injection at 11 a.m. on paper, even without order of doctor? So these kind of discrepancies in treatment sheet and nursing chart creates problem. So dear friends, we must know that what is importance of document, because document is the only weapon in our hand to protect ourselves. And we can also say that document is only shield in our hand to protect ourselves from the weapons of patient. Multiple landmark cases I can quote for documentation. One of them is Kunal Shah's case. That in that case, Amri Hospital and Bridge Candy Hospital were made party. The record for 7 days admission in Amri Hospital was 23-page record, while patient remained admitted in serious condition in Bridge Candy Hospital for 10 days, and the records or document of Bridge Candy Hospital was around 400 pages. The document was done by Dr. Udwadia in so much detail. He has mentioned everything in the document, that the husband of the patient is surgeon, himself surgeon. He is continuously interfering in the treatment. He is misbehaving with the staff. He is demanding to start certain medicines, which I don't think that required. But as there is no harm in giving, I am giving it. Certain medicines, brother of that surgeon, who also is surgeon in US, has brought some medicine from the US, injection, antibiotics, quinolone, which were not available in India. And he was insisting to start these medicines to the patient. But doctor said that I refuse to start because this may cause harm to the patient. So everything was mentioned in detail by the Bridge Candy Hospital. And that's why Bridge Candy Hospital was saved from giving compensation. The same was not done properly by Amri Hospital. And you know that 6.76 crore rupees compensation was granted, and with interest, it rose to 11.5 crore rupees in that case. In another case, Soni Verma versus Indu Sharma, I have already mentioned that in that case also, it was presumed by the court that doctor tried to alter the record. And because of that, compensation of 1 crore rupees was granted. In Jaipal Reddy versus Dr. Padmini Velluri's case, the consent paper was signed by doctor and patient, but the blanks in between were not filled. And court has said that consent paper is not mere a paper which a patient signs, but consent paper should be regarded as documentation of counseling and communication done to the patient. So if doctor has no time to fill the blanks which are there in the consent form, how can we presume that doctor would have explained everything to the patient? And case went against doctor, decided against doctor. So dear friends, there are many judgments which I can quote. More than 1,000 judgments are there. I cannot quote every judgment here. But dear friends, if your documents are perfect, you can be easily saved in the court of law. We have done an analysis that 90 to 95% cases which are decided against doctor in different courts and commissions, the reason behind that is poor documentation. Rest 5% to 10%, it is because poor representation. So if you take care of your documentation, definitely it is a powerful shield to save yourself in the court of law. Last but not least, I would like to say that the secret of my success is I do things as a matter of habit, what others do out of fear of law. So dear friends, don't prepare document with the fear in your mind or fear of law, but make it a habit. Make it a habit that how to prepare documents. So if you will prepare proper documents, you will definitely be saved properly. Good medical record is not just necessary to save your skin in case of medical legal problem. but good medical record is a reflection of good patient care. So if you will prepare a good discharge card, and if that discharge card will be shown to another hospital, your standard will be decided by looking into your discharge card and your case paper by that other hospital. So dear friends, make your documentation proper to save yourself in the court of law. Thank you. Thank you very much.
Thank you so much, sir, for your valuable support and valuable guidance to all the viewers. Thanks a lot, sir, from Corona Remedies.
Thank you.
Bhumit is there, sir?
Yes, yes. Calling.
डायरेक्ट एंड करवाना